Welcome back to Primetime News.
And a special welcome to those of you watching on onespotmedia.com as well as TVJ International in the Cayman Islands.
Up first this evening, the Ministry of Health says the death of a newborn at the Jamaican hospital in Clarendon earlier this month was not as a result of limited ventilators, but the lack of specialized staff to care for the baby.
The revelation was made during a press briefing this morning. But since the baby's passing, what changes, if any, are being made to prevent the hospital from having a recurrence?
Jamaica Maitland tells us more.
Senior medical officer at the Jamaican hospital in Clarendon, Dr. Bradley Edwards, revealed that the hospital only has 2 critical care nurses to treat patients with severe respiratory failure. Dr. Edwards says the hospital will begin the process of training doctors to complement a team of specialized staff following the death of a newborn baby earlier this month.
The team currently, we have about 2 critical care trained nurses currently who are capable or have been trained on managing ventilated patients. At this point in time, we now need to work on the medical side, which is ideally managed by a neonatologist. And I do believe that perhaps in the future we need to try and acquire such a person.
As it relates to how soon the hospital would be able to employ the specialist, the Ministry of Health wasn't able to say either. Does it mean a newborn could die of a similar cause there again? According to Dr. Edwards, a meeting was held on Tuesday to discuss the way forward.
All the different hospitals came together to come up with a solution to see how best we could handle a situation like that may arise.
But the Jamaican hospital isn't the only public health facility with a staff deficit. Chief Medical Officer Dr. Jacqueline Bisesa McKenzie says the issue is widespread.
Many of our hospitals are in that position. They may have the capacity because they have a ventilator, but they're not able to offer that care because they do not have all the staff in place. And so the number tends to fluctuate from time to time.
The high dependency units at some hospitals for newborns also don't have adequate staff. Those that do are simply full.
If it is that we have 60 or 70 ICU or HDU spaces, then we need 4 times that amount of nurses to be able to support the patient on the 3 shifts and to allow for them to have breaks.
And although not all 24 hospitals island-wide have a ventilator, Health Minister Dr. Christopher Tufton says there is still no shortage. According to a recently conducted audit, there are 210 ventilators, 118 are functional.
40 are going through a process of maintenance. The rest are obsolete. They are not functional. They can't be used. And so there's a process that is involved in getting them out of the system.
The Chief Medical Officer says there is constant recruitment and training being done to ensure that there is always a pool of specialized healthcare workers. The issue, she says, is with migration.
Especially our trained specialist nurses tend to leave the country after a while to seek better lives, better opportunities.
Jamaica Maitland, TVJ News.